Friends, today I'm going to discuss a very important topic that is called difference between angina and heart attack. Heart attack is popularly in medical science called myocardial infarction, where the heart is damaged, but in angina there is no damage of the heart. Let me explain the difference. First, you must understand what is heart problem. Heart supplies blood to the whole body, and for its own supply it needs three tubes, and these are called coronary arteries. These coronary arteries, they get deposits of fat. The fats that we don't use get deposited over there, and the deposits close the tube gradually. They narrow down the tube, and once the narrowing is more than 70%, then the patient can feel the difficulty. Till that time, patient does not feel difficulty because his requirement is only 10%, 20%, 30%. Supply is 100, but requirement is only 30 when he is running, when he is exerting too much. When he is walking, then maybe 20, and when he is sitting, only 10%. So the person says, if I walk, if I climb, if I jog, I get a chest pain and it is going to the left arm, or I get a breathlessness, or I get a choking sensation, and it stops when I stop. When I take rest, this difficulty stops. This means angina. This means the blockage is already crossed 70-80%. Now, how to confirm? You can do a treadmill test or a stress test, which will tell you whether it is angina or not. The ECG will so change as the pain comes. And if you want to reconfirm it further, then go for a CT angiography, which will tell you how much blockage is actually there in the heart tubes and which tubes are affected and in what location the blockages are there. Now let's come to the other one called heart attack. Heart attack is little worse than angina. Here the blockage was growing and suddenly the blockage has become 100%. How does it become? The blockage is covered by a membrane which gets stretched as the blockages grow, and one fine day the membrane bursts, called intimal membrane or endothelial membrane. Once it bursts, chemicals are released and they clot the blood. And once the blood clots, the tube has become suddenly 100%. 100% blockage will be known by the patient within 10 seconds. He says, I get a tremendous pain on the left side, squeezing pain, severe pain, and it is going to the left arm. And I get choking, I get breathlessness, I also get sweating and vomiting. These are definite symptoms of heart attack. If you have this, you must confirm it. Means some area of the heart is already damaged or dead. It is dying and the pain is severe. And that time you can confirm it by the two tests. One is called the TROPT test, which is a slight test like a pregnancy test. You put a few drops of blood in that and it will say yes or no heart attack. And you can also confirm it by ECG. And later stage, we can do an echocardiography and find out how much damage was there by the heart attack. So friends, there are two different things. One is angina, where the damage is not there, but in heart attack, the damage has already happened. Most of the deaths happen after a heart attack happens, and when the large area is killed or suddenly important area is killed and the heartbeat jumps up to create a ventricular tachycardia, VT, and that time the patient may die. So friends, you must know the difference. You must prevent heart disease before it grows from angina to heart attack. And if you have angina, we at SAAOL solve this angina by lifestyle change, by food habits, by exercise, by giving you allopathic medical management, and also natural bypass and detox therapy. You want to know more about it? If you have any specific queries about the disease, or you have some topic which I can tell you in future, please let us know in the comment box, and please share this video with everybody that you know. These videos can make huge difference in patient's life, and please subscribe our channel. Thank you so much.